So, good day everyone. I am Dennis Marian Basa and I am here to present my case. So, my case is subarachnoid hemorrhage secondary to ruptured cerebral aneurysm. So, it's more of the cerebral aneurysm and then its complications. So, my attack will be more of on the clinical or in the practical side. So, it is nice to know that we have diverse types or styles or techniques. So we have a more detailed and we also have a presenter who focused on assessment more. So let's define first the cerebral aneurysm. It is an outpouching of the wall of a cerebral artery that results from weakening. So that's our keyword, weakening of the wall of the vessel or the vasculature. It is difficult to determine the frequency of this type of aneurysm because there are differences in the definitions of the size and the way that aneurysms are detected. So let's go on first on the anatomy and physiology. So it is more likely focusing on the circle of Willis, which is the junction of the four many arteries that supply the brain with nutrition, so which are oxygen and glucose, two carotid arteries and two vertebral arteries. So this loop of arteries is located at the base and sends out smaller branch, or it branches out to smaller arteries. The junctions where these arteries come together have weak spots. These weak spots can balloon out and fill with blood, creating the outpouchings of blood vessels. So ito yung tinatawag na parang naglolobo siya, nagbaballoon. And these outpouched blood vessels or ballooned blood vessels are known as aneurysms. These sac-like areas may leak, may rupture, may spill blood within or around its surrounding tissues. Cerebral aneurysms, so we have to talk about the facts first. So cerebral aneurysms are common but most are asymptomatic and accidentally daw nakikita sa mga autopsy. Aneurysms can leak or rupture causing symptoms. So pwede siyang from severe headache and up to stroke-like symptoms or CVA bleed. So usually ito yung nagiging presentation natin ng patient sa ICU or in our neuro ICU. First, parang nagkaroon ng loss of consciousness, so yun ang presentation niya. And then, CVA bleed, only to find out after several tests that the patient's real or main etiology